First of all, I want to thank Dr. Sharda Jain ma'am that you have given me opportunity to talk on breastfeeding myths and facts. Before that, just now we have heard about basic life support. That is very important. And the few that the ma'am has told जन आंदोलन, तो इसको कुछ जन आंदोलन का वर्ड बहुत अच्छा लगा, उसको करना पड़ेगा और आप सबका साथ चाहिए होगा इस चीज के लिए. और we are figuring it out how to do this thing within a 15-20 days. हमें कुछ पता लग जाएगा जिससे we can do in future how to do BLS and to train all doctors, laymen, school, then the colleges, then the police staff, and we try to do something very big. But इसके लिए आप सबका साथ बहुत जरूरी है. Now I'll start breastfeeding myths and facts. Madam has already this week we have done many um, uh, presentation on this, and everybody knows very well. Breastfeeding is a natural and beneficial process for both mother and child. It is surrounded by numerous myths and misconceptions. Breastfeeding provides numerous benefits for both the infant and the mother, which include optimal nutrition, immune support, and emotional bonding. What are the benefits? What will be the benefit for baby? It provides a perfect balance of nutrients, antibodies, and enzyme to a baby need. And this composition changes as the baby grow. And it helps in the cognitive development. If the baby is breastfeeding, as breastfed babies, they may have higher IQs and better cognitive development and stronger immunity, which contains antibodies to protect against the infection, allergies, asthma, and the illness. And it reduces the risk of disease like obesity, type 1 obesity, SIDS, and any other chronic conditions. So these are the things which will helpful for the baby. And for mother, it will help in faster postpartum recovery. It helps the uterus contract and return to its pre-pregnancy size, and it reduces the postpartum bleeding too. And it helps in weight loss also. It burns extra calories during adding in postpartum weight loss. And it reduces the risk of cancer, linked to a reduced risk of breast and ovarian cancer. Emotional bonding. It increases emotional bonding between the mother and the baby. It promotes a sense of well-being and reduces the risk of postpartum depression. That is very important. WHO has given 3 golden rules for breastfeeding. Start breastfeeding within the first hour of the birth. Give only breast milk for 6 months. No honey, no cow milk. Continue breastfeeding up to 2 years along with the family food. What are the common breastfeeding myths and the facts? See, first is breast milk. Cholesterol is a dirty or impure. What is cholesterol? It is a nature gift of the immunity and nourishment, a powerful state of the life. It is often called a liquid gold. It packed with antibodies, nutrients, and the growth factor. And it acts as a shield from infection with its rich immunoglobulin content. Or it lays the foundation for lifelong health and strong immunity. And nature knew what the first feed should be: pure, protection, and perfect nutrition. So this is the fact. What is the second myth? Breastfeeding is always easy. Fact is, while natural breastfeeding can take time and practice for both mother and baby, many mother need support with latching and positioning. Breastfeed should be painful. Some of the female, they come and say there is no pain. It's not necessary. Initial tenderness is normal. Pain indicates improper latching, which can be corrected with the support from a lactation consultant and the doctor. You should only eat bland food while breastfeeding. This is a myth. What is the fact? Breastfeeding mother needs restriction only needed if the baby shows some specific sensitivity. You can't breastfeed if you are sick. Mother can continue breastfeeding when sick. Antibodies produced pass to the baby and offering the protection. Myth is breastfeeding causes sagging breast. But fact is pregnancy, genetic, and aging and the primary influence breast shape, not the breastfeeding itself. So it's not necessary if you're feeding a baby, it will cause sagging. There is a multiple reason of the sagging of the breast. You need to wash nipple before each feed. Washing nipple before feeding is not necessary. Babies are familiar with their mother's scent and nipple produce natural substance that help and build the baby's immune system. But still we have to maintain the hygiene. That is most important. Formula milk is same as breast milk. While formula can provide adequate nutrition, but breast milk unique composition include antibodies and live cells cannot be replicated. Many mothers they don't produce enough milk. Most of the patient comes and says the baby is crying, I'm not able to produce enough milk. Almost all mothers they produce enough milk. Production it is based on supply and demand. In between the mother keep on giving formula feed and something like that. The baby is crying, but we have to see if the continuous production will be continuous. It depend on supply and demand. This is very important. Storage of breast milk. Rule of 4 in breastfeeding generally refer to the guideline for storing and express breast milk. It is not a rigid feeding schedule. It suggests that breast milk can be safely stored at room temperature for up to 4 hours, in the refrigerator up to 4 days, in the freezer for up to 6 months. Different organizations, they have slightly varying recommendation, but 446 or 4412 guideline is a common preference. If mother is having some problem and mother is going for a work and something like that, mother can take out their feed and it can be kept at room temperature for 4 hours. With the myth and fact, I have added what are the types of the breastfeeding positions. One is very important, that is a cradle hold. It is a common position. It provides enjoyable feeding and bonding experience for both of you. Sit somewhere with the support to keep your arm at the right height, like an armchair or couch. If needed, you can use pillow to support your arm. Position your little one in your lap with their head in the crook of your arm. Keep your baby chest again yours so that they don't have to turn their head toward your breast. If necessary, use pillow to support your baby head. This is the common position cradle hold. Then one more is the cross cradle hold. In this position, it is same like that, but it allows you to have a good control of your baby's head while helping your little one to latch on. Think of this as the reverse of cradle hold. To perform the cross cradle hold, position your baby in the opposite direction of the cradle hold with their head in your hand rather than crook of your arm. If you want to use your other hand and you want to latch, then this will help you out. Cross cradle hold. One more is under arm hold, that is called football hold or the rugby hold. In this, you have to carry the baby like a football along your forearm with your baby's body on your arm and face toward your breast. Position your baby's leg under your arm. Use your other hand to support your breast. This hold is helpful if you have undergone a cesarean section and can't place your baby on your stomach while nursing. One more, sideline position. If you and your baby are more comfortable lying down, this is a great position. Lay on your side and place your baby on their side facing you with their head at your breast. Support your back with pillow. Make sure that your baby's nose is not obstructed. One is a reclining position. This, if your little one has a difficulty latching or restless and crying, this is a calming position. In fact, this position is sometimes called biological nurturing. Support yourself, your pillow, and learn far enough back for your baby to be fully supported. In whatever is the position, baby should be fully supported, and that you have to take care. Lay your back, baby, prone your chest to engage in skin to skin contact, and lay your naked baby on your bare chest and enjoy bonding with your little one. Normally, we people used to do and tell patient to go for a kangaroo, like the keep the baby on your chest. Then it will increase the bonding with the baby. What are the signs of good latch? Comfortable experience with no pain. More areola is visible above your baby mouth. Then below, your baby mouth is wide open, their lower lip is turned out, their chin is touching or nearly touching your breast. What is the sign of good positioning? Your baby head and baby are in a line. Baby cannot suckle or swallow easily if their head is twisted or bent. Your baby is held close to your body. You can't attach well to the breast if they are away from the far away from it. Your baby's whole body is supported with the arm along their back. That is very important. Your baby approaches breast nose to nipple so that they come to your breast from underneath the nipple. How it will come to know कि baby is sucking good or not. What are the effective suckling? Your baby takes slow deep suckles, sometimes pause. You may be able to see to hear your baby swallowing after one or two suckles. Suckling is comfortable and pain free for you. Your baby finishes the feed, releases the breast, and looks contented and relaxed, or your breast is softer after the feed. Benefit of skin to skin connect: it calms and relaxes both you and your baby. Skin to skin regulates your baby's temperature, heart rate, and breathing. It stimulates digestion and an interest in feeding. It helps and provides protection against infection. What are the breast coming? Few are the challenges I have added in this, like sore nipple. First, we should ensure proper latching. Try different position. Use nipple cream and express breast milk for healing. If there is a sore nipple, better to express the breast milk instead of giving the instead allowing the baby to feed. Engorgement. Breastfeed frequently. Apply warm compresses before feeding and cold compresses between the feeds. If there is a low milk supply, breastfeed more often ensures proper latch. Stay hydrated. Consider the supplements under the professional guidance. If the plug ducts are there, continue breastfeeding. Apply warm compression. Massage the area. Consult a doctor if the blockage does not clear. Mastitis. Continue breastfeeding. Apply warm compresses. Rest. Then seek medical attention if patient needed antibiotics or not. This I have taken from ma'am's slide. Why 100% breastfeeding matters a gynecologist perspective. 10 reasons why gynecologists should aim for 100% breastfeeding. Optimal nutrition. It gives optimal nutrition, boost immune system, increase brain development, bonding and emotional benefits, lower the risk of disease. It supports the maternal health. It is convenient and cost effective. Environmental benefit, or it reduces waste and carbon footprint associated with the formula production. Long-term benefit, it has been linked to low rate of obesity, diabetes, and certain cancers. Global health recommendation, WHO recommends exclusive breastfeeding for the first 6 months. What is the theme for Breastfeeding Week 2025? It is prioritizing breastfeeding, create sustainable support system to create a breastfeeding friendly environment together at all levels: national, health, workplace, and community. Breastfeeding in India, it's a reality check. Earlier, early initiation of breastfeeding, only 40% of newborns are breastfed within the first year, and WHO goal is 80%. Exclusive breastfeeding 0 to 6 months. Certainly in the India, it's 65%, but WHO targets 70% by 2030. So we have to only gynecologists and the staff can make this goal targeted nearly 70% by 2030. Let's make every hospital baby friendly, every waiting room a space for feeding, and every woman confident to breastfeed in a public space. Privacy should be provided by us. Conclusion: dispelling breastfeeding offers immense benefit for mothers and baby, and it dispelling the myths and understanding facts, which helps to make informed decision. Seek support from the healthcare providers and lactation consultant when needed. Valuable investment in lifelong health and well-being. This is very important. Thank you.